for year 2023. Today's lecture actually is the first from 4 lecture series. Julius, would you mind to share our lecture series?
Is the
Okay, we will have 4 lecture series in January, and the 2nd and the 3rd in February, and last with the ambassador, His Excellency Mr. Kanasugi in March. This events of ambassadorial lectures is Center for Japanese Studies, Universitas Indonesia, and Japanese Embassy Indonesia collaboration for enhancing Japanese studies development, especially in Indonesia. No time further. First, we would like to ask the head of Center for Japanese Studies, Universitas Indonesia, Dr. Diah Madubranti, for your opening speech. Dr. Diah Madubranti, the time is yours. Unmute dulu, Bu Diah.
Yes. It's my trouble in my computer. I'm sorry. Good morning, everybody. Good night, Mr. Dr. Inoue Hajime. Good morning, His Excellency, the Ambassador of Japan for Indonesia, Mr. Kanasugi Kenji, Attaché of Education, Ms. Kawakubo Mariko, Dr. Lea Santia, our CEO of the 11th Ambassador Lecture Series, Mrs. Susi Nataliwati, Ms. Nisa Natalia, Ms. Julian from the Embassy of Japan, Jakarta, Ms. Julius, and Ms. Access. Good morning to all of the participants. Nice to meet you in virtual lecture today, but let me do speech in bahasa. Selamat pagi seluruh peserta kuliah umum pertama Ambassadorial Lectures XI 2023. Sangat berbahagia pada hari ini kami bisa bertemu dan berkumpul mengikuti kuliah umum perdana dari seri ke-11 The Ambassador Lecture Series yang sudah diselenggarakan selama 11 tahun, sejak tahun 2012. Kuliah ini diselenggarakan oleh Pusat Studi Jepang, Universitas Indonesia, bekerja sama dengan Kedutaan Besar Jepang untuk Indonesia. Sebenarnya, kuliah umum ini diselenggarakan secara offline di Aula Pusat Studi Jepang dengan peserta dari seluruh universitas yang ada di lingkungan Universitas Indonesia dan seluruh Indonesia. Sebenarnya kuliah ini sejak tahun 2020 ketika ada pandemi, kita sudah bertemu melalui virtual Zoom. Hanya hari ini saya mohon maaf, saya ada masalah di komputer saya sendiri. Saya ingin mengucapkan sekali lagi rasa terima kasih kepada Bapak Dr. Inoue Hajime yang telah bersedia memberikan kuliah umum dari negeri yang amat jauh dari Amerika yang berbeda waktunya dengan Indonesia. Seperti yang diketahui bahwa kita semua dihadapi oleh pandemi COVID sejak akhir tahun 2019 sampai dengan hari ini. Penanganan pandemi di setiap negara berbeda-beda, baik di bidang ekonomi maupun sosial. Berkaitan dengan pandemi, kita semua tahu bahwa Jepang merupakan salah satu negara dengan tingkat kematian akibat COVID-19 yang rendah. Sangat menarik untuk kita pahami bersama bagaimana sikap dan tindakan pemerintah dan rakyat Jepang dalam menanggapi pandemi ini. Bagaimana perkembangannya dalam menghadapi tahun krisis 2023. Saya rasa saya tidak akan berkepanjangan dan berpanjang lebar untuk menjelaskannya, tapi Dr. Inoue Hajime yang ahli dalam bidangnya ini akan mempresentasikannya dengan tema Japanese Response to COVID-19 Pandemic. How does it work? Mari kita saksikan bersama. Terima kasih dan terima kasih kepada para peserta yang sudah hadir di dalam acara ini. Sekian, terima kasih.
Terima kasih Dr. Diah Madubranti. We would like also to ask First Secretary of Education, Embassy of Japan in Indonesia, Kawakubo Yuriko-san, to give your short speech. Kawakubo-san, the time is yours.
Yes, terima kasih. Dr. Inoue Hajime, Advisor, Health, Nutrition, and Population Global Engagement, World Bank. Dr. Ibu Dia Madubranti, Head of Pusat Study Japan, Universitas Indonesia, all the distinguished participants, ladies and gentlemen. Selamat pagi, nama saya Yuriko Kawakubo, Attaché Pendidikan dari Kedutaan Besar Jepang. Terima kasih banyak atas kesempatan hari ini. Thank you very much for joining us today for the Ambassadorial Lectures. In particular, we are grateful to Dr. Inoue for taking time out of his busy schedule to give us a valuable lecture. On behalf of the Embassy of Japan in Indonesia, I'd like to take this opportunity to say a few words. PSJ, Japan Research Center of Universitas Indonesia, and the Embassy of Japan have been co-organizing a series of Japan-related lectures every year since 2012 for Indonesian university students. This year, 4 lectures are planned to be delivered with 4 themes related to COVID-19. Today, Dr. Inoue will talk about Japanese experience from the field of healthcare policy. There is much to be learned from him. After his lecture, we will have Q&A session, and we hope that you will ask him many questions. I also believe that there is much to be learned from Indonesia's experience and your point of view. Finally, I'd like to express my sincere gratitude to the staff of the Universitas Indonesia for their efforts in organizing today's lecture. I'd like to conclude my remarks by wishing that we learn a lot from each other and also wishing that you will not be infected with COVID-19 anymore. Terima kasih.
Terima kasih Kawakubo-san. And then we go to main session, and our today lecture will be moderated by Dr. Lea Santiago, Master of Education. Dr. Lea Santiar is a lecturer in Faculty of Humanities, Universitas Indonesia, and she is majoring in Japanese language and Japanese linguistics. Dr. Lea Santiar, the time is yours.
Good morning. First of all, in a way sense, good morning, kawanku bosan. I'm sorry if I have trouble. Can you hear my voice? Is it okay?
Yes.
Okay. I have trouble with my laptop, so sometimes there is two tip device. I'm very sorry. I will read Dr. Inoue's profile to introduce Dr. Inoue to us. Dr. Inoue Hajime started his professional career as a pediatric resident in Tokyo and then served as a field officer of the maternal and child health program in rural Philippines. After postgraduate studies in public health, Dr. Inoue joined the Japanese Ministry of Health, Labor, and Welfare. He acquired a wide range of technical experience in critical areas of the global health agenda, including universal health coverage and health systems, community health, health emergency, health promotion, population aging, pharmaceutical regulation, antimicrobial resistance, and hospital management. He has also worked for WHO as a senior advisor to the Director General and Special Representative for Antimicrobial Resistance. He has in-depth knowledge on the political arena, serving as G20 and G7 Sherpa of WHO. Some of his most recent accomplishments, including developing a new financing mechanism, contingency fund for emergency at WHO, managing the biggest national hospital in national hospital in Japan as its Director General, and forming the National Response Plan for COVID-19 as the Chief Technical Officer of the Cabinet Secretariat. His recent appointments were Assistant Minister for Global Health at the Japanese Ministry of Health, and currently as an advisor at the World Bank Health, Nutrition, and Population Program. Dr. Inoue holds a medical degree from Tottori University, Japan, along with a Master of International Health from the University of Tokyo, Japan, and a Master of Public Health from Harvard School of Public Health, USA. He also is a Doctor of Public Health from Tokyo University, Japan. So a very long profile of Dr. Inoue, but I will give the time for Dr. Inoue's presentation. So please, Dr. Inoue, you can start your presentation.
Thank you very much, friends and colleagues, for your very kind introductions. And I'm very pleased to have this opportunity to share with you my own experience on Japanese response to COVID-19. May I share my slide, or is it already shared?
You can share your slides, I think.
Okay, just a moment. Is it shared with you?
Yes, it is already shared. We can see your slide.
Thank you very much. Well, pandemic has not yet over, but in the past 3 I've been exclusively working for the response of this pandemic at various, first at the National Referral Hospital for Infectious Disease, then second,
Hmm.
is my slide shared and am I audible?
Not yet, Sensei. I think you must reshare your slide.
I will do, just a moment.
Okay, now we can see your slide.
Okay, thank you very much. So with my experience to respond to COVID-19 in Japan, let me review all these responses and happy to work with you. How does it work? This is the outline of
Inoue Sensei, are you there?
I'm sorry for the mechanical trouble. Now, could you hear me?
Yes, we could hear you, Sensei. I'm sorry, Inoue Sensei, if I may, maybe I can share your slide from my screen. So
Yes, please do so. Please do so.
Okay, I will try to share your slide from my.
Yes.
Sensei, can you see my slide now?
Yes. Yes.
Okay, Sensei, maybe you may speak
Okay.
once. Just tell me if you want to go to the next slide.
Okay, so next slide, please.
Thank you.
Okay, so here's the outline of this the 30 minutes presentation. I'd like to talk basically the 5 points. The first is the pandemic in history. How did it affect us? As everybody knows, this COVID-19 is not the first one, and most likely will not the last one. So I just want to take a stock of what's the pandemic in history. Second, pandemic, not in the history, but today in the modern world, could be controlling. Thirdly, in COVID-19, Japan actually faced fundamental difficulties, which could be a little bit different challenge from other countries. And let me touch the point about our own problem. Fourthly, how does our response work or does not work from my personal experience? And the fifth, lastly, just a summary of all these presentations. And let me allow to say that my presentation is based on my personal view, not representing an organization that I'm currently working for or previously working for. So next slide, please. As I said, the COVID-19 is not the first pandemic in human history. Actually, when we look back our history in every places, every continents, there have been dozens of pandemics recorded in our history. This picture is one of the most notorious, most well-recorded one, based on the so-called Black Death in 15th century in European continents. At that time, it is estimated that 1/3 of European population actually died because of this 3-4 years of pandemics of pest. So not only this one, but there are dozens of pandemics in human history, and the COVID-19 is just the latest one. Next slide, please. You see this slide, mortality rate in US in last century from 1900 to 2000. The black one is the all causes of the mortality per 100,000 people per year. How many people died out of 100,000 populations? Blue line is that of non-infectious disease breakdown, and the red line is that of infectious diseases. One of the most visible characteristics of this slide is, of course, a sharp spike in 1918, 1919. Apparently, this is because of the Spanish flu 100 years ago. So you could see the actual magnitude of the pandemic recorded in mortality rate in US. Next slide, please. Just to compare, no, one more back, please. Just to compare this spike caused by the Spanish flu and this red circle in early 1940s. In early 1940s, there is a mild increase in mortality rate. This is presumably because of the World War II. Just compare the change of the mortality rate between Spanish flu and that of World War II. World War II is one of the biggest events in the history, human history of the 20th century. But from the standpoint of mortality or how many people died, it's not that much comparable to the Spanish flu. So this is the actual magnitude of the pandemic in human history. Just one example. Next slide, please. Actually, in the 20th century, there are 3 pandemics recorded, all of them coming from influenza. The most notable one, as I mentioned, Spanish flu in 1918, followed by what they call Asian flu, then Hong Kong flu. Then Spanish flu, 50 million people died, followed by Asian flu, 1 million, Hong Kong flu, 1 million. So pandemic just in 1 century, 3 times happened. Next slide, please. So this is the brief history of pandemic. I mean, pandemic actually occurs repeatedly, dozens of times in human history. And in my personal opinion, is likely to do so in the future as well. Then the second part of my presentation is, while we actually look back briefly about the history of pandemic, how does it affect in our modern world? Or in other words, could we control the pandemic in the near future? Next slide, please. This is the global, the disease burden in peacetime, just before the start of the pandemic in 2019. This actually shows which diseases have greater burden than other diseases. The blue portion is non-communicable disease. IHD, for example, means ischemic heart diseases, stroke, lung cancer. You see many diseases here. The red portion is communicable diseases, and the green portion is accident and injury. And the thick color means the situation is worsening. Bright color is situation is getting better. So you can see which diseases have a heavier burden in the world, which is lighter the burden in the world, and so on. And on the right upper corner, there is a word LRI, lower respiratory infections, which includes the infectious diseases, lung infectious diseases like COVID-19. These lower respiratory diseases in peacetime consists of just 4% of the global disease burden. So it's not a substantial diseases in peacetime. Next slide, please. This is the same map for Indonesian cases. In Indonesia, actually the biggest burden is IHD in the left upper and ischemic heart diseases, followed by stroke, or you could see very thick blue, dark blue color in diabetes, or colorectal cancer, something like that. So these are the major diseases in Indonesia in peacetime. And the upper right end LRI, lower respiratory infection, including COVID-19 type, the lung infection consists only 2% of the total disease burden. So this is in a peacetime, not a serious problem, but all of a sudden it turned to a national security issue. Next slide, please. And this is the estimated number of people died related to COVID-19. We actually measure this estimated number by excess deaths. Excess deaths means that by how many people died more than previous peacetime. According to these statistics, the confirmed COVID-19 deaths as of now is about 6 to 7 million. Whereas actual number of excess deaths, I mean the excess from the peacetime, is far more than time. There are certain the lower estimate and the upper estimate, but in the central estimate, it's more than 20 million. In the first 20 million, in the first 3 years, more than 20 million people worldwide actually died related to COVID-19. It's a huge number. Please note that just before the start of the COVID-19 in 2019, the annual global deaths by all causes is 55 million. So compare with this figure. In the peacetime, globally, 55 million people dies of various reasons. In the past 3 years, only for COVID-19, more than 20 million died. It's a huge impact. Next slide, please. And actually, the impact of the COVID-19, as you fully aware of, is far beyond health. This is just one example. Real GDP growth rates in 2016 to 23. Of course, one of the most notable changes in this graph is what happened in 2020 because of the obvious reason. Next slide, please. It's not just economy. Currently I'm working for the World Bank. One of the mission of the bank is to end the extreme poverty. So we are actually following up the number of people suffering from extreme poverty. In the first 3 decades, starting from 1990, this number is steadily decreasing, or in other words, improving. But this trend suddenly changed in 2020. So it's not just the number of people died, but it affects disproportionately to the disadvantaged population, like this graph. Next slide, please. One more examples of the impact of COVID-19 being far beyond health. Learning poverty. You see the share of 10 years old children unable to read and understand just the basic text of his or her local languages. This figure is in globally about 50% to 60%, now suddenly increased to 70%, which is really a serious problem. Actually, this is 10 years old, meaning that these 10 years old boys and girls will live in the next 60, 70 years. So actually, just the 3 years of pandemics actually have a lasting effect, negative effect for whole the generation, which is really beyond health. And beyond these 3 years, it actually affects for the whole next generation, which is really a serious impact. Next slide, please. And COVID-19 is, as I said, not the first one in human history, and actually not the first one in 21st century alone in the past 22 years. I just listed sizable, substantial outbreaks and pandemics in this century in the first 22, 23 years in the chronological order. Perhaps you can recall all these names: SARS, H5N1 avian influenza, H1N1 pandemic, MERS, Ebola, Zika, and now COVID-19. So in average, every 3 years, there is a sizable outbreaks, huge outbreaks of a pandemic that affects not only human health, but all the socio-economic activity of the globe. So it's not just rare once in a generation, once in a century things. It happens in this frequency, in this modern world. And most likely that COVID-19 may not be the last one. We have to prepare for the next one to come, even though the ongoing COVID-19 have not yet finished. Next slide, please. Is the pandemic still a threat? I mean, there are two different views. It's no more on the, could you please one slide back, please? It's a balance of no more and yes. No more, the opinion says that now it's a modern world. There is a scientific progress there. Public health is more robust. Our population gets better nutrition than previous times. Now we have IT and better communication system. We have a domestic and also international legal framework to respond to the pandemic. And in the peacetime, we are well prepared. Therefore, there is no more pandemic anymore. So this is the one school of thoughts. The other side on the left side, yes, it's still a threat because of several factors that I stated here. For example, international travel, which is not an issue in 100 years ago, or bioterrorism. This is also a recent phenomenon. And also contact with animals. I mean, majority of the re-emerging infections are actually coming from animal world. And we have more and more contact with animals. And also property rights is also an agenda. Whenever we develop a new medicine is usually protected by product rights, property rights, which have a certain hurdle for this new medicine to be widely available. Another issue is population density. We have more and more population, more and more urbanized. So human-to-human direct contact is more dense compared to the previous times. And also, whole of our population is aging rapidly. These are actually negatively effects for us to respond to pandemics. So there is a balance of certain progress and certain emerging challenges. And taking all these the different factors into a balance, many people feel that the pandemic is not over. This COVID-19 will not be the last one. The next one will most likely to come. It's just a matter of time. Next slide, please. This is to explain about one of the elements that affects to the pandemics. Number of people living in urban and rural areas in the world since 1960 to current days. You see that it's not just the total number of population increasing, but also the share of the people living in urban settings are increasing. This makes the infection control, pandemic control even more complicated and challenging. Next slide, please. We actually see it in a long historical perspective of first 12,000 years. The share of the population living in urban areas is like this. I mean, this urbanization is in our whole human history just a very recent phenomenon of last 100 years. So even though we have a certain development in our technology, communication, medicines, still we are facing challenges to cope with the pandemic because of several factors. This is just one of the examples. Next slide, please. Let me also turn on the other challenges, human-animal interactions. As I said, in this century, in the past 22 years, we have 6 or 7 substantial outbreaks, global outbreaks experienced. All these 7, the outbreaks have one commonality, meaning that these pathogens are actually coming from human-animal interfaces. For example, influenza, there is a human influenza which actually infects among humans. There's an avian influenza which affects basically in principle only among avian or birds. But once these 2 different types of influenza coming into different animals like pig, then these 2 different virus, one in influenza human virus, the other in avian influenza virus, merge into one, which means that originally the birds influenza virus converted to infectable to human beings. So this is a risk of reassortment of the virus. Next slide, please. Then the third portion of my presentation is based on these, the history and the modern challenges. There is some fundamental difficulty in Japan to cope with COVID-19, mostly coming from our demographic situations. Let me explain a little bit about it. Next slide, please. This is the data from Japanese Health Ministry, showing that actually out of all the people died from COVID-19 in the first 3 years, how old are they? the COVID-19, the cumulative deaths by gender and age in Japan, you could see that the majority, I would say, of the people unfortunately died by COVID-19 in Japan in first 3 years is 90s, in his or her 90s or 80s or 70s, all seniors. COVID-19 actually disproportionately affects seniors. This is not only the case in Japan, but the global phenomenon. Keeping this in mind, next slide, please. This is the percentage of people who is 65 years or above out of the total population. In Japan, 28% of our population is 65 years or older, compared to 6 or 7% in Indonesia. Japan is the most aged society. This actually puts extra difficulty for Japan to respond because COVID-19 disproportionately affects our senior citizens rather than our younger generations. Next slide, please. Next challenge is urbanizations. This is respiratory infections from human face to other human faces. So the human to human contact is the critical factor for the infections. So which means that if we have a dense population density, we have more challenges, and you could see these pictures of Tokyo. Next slide, please. This is the five largest cities in the world by UN population data. You could see that the Tokyo, Greater Tokyo, with its population of 37 million, is the largest cities in the world or in human history. The large agglomeration of the people puts extra difficulty in Japan, together with other countries, other cities like Delhi, Shanghai, Sao Paulo, Mexico City, or perhaps Jakarta also faces certain challenges as well. But this is the other example of Japan's difficulty. So in short, in summary, Japan have an extra difficulty because of our demographic situations. The first, we are the most aged society. Second, we are more urbanized, the society. So these two actually, in combination of these two factors, actually makes our response extremely difficult. Next slide, please. Then the fourth chapter is how actually does our response work or not work? Next slide, please. To evaluate our response, one of the criteria for the evaluation is how many people unfortunately died because of the COVID-19. And we actually couldn't actual reporting case is not that precise, so we actually evaluate by excess deaths. Excess deaths means that how many people died more than usual time or peacetime. And this is the comparison of excess deaths among 4 countries, namely Indonesia, Japan, United States, and China in the first 3 years. Of course, each country have a different population size, so we have to take that the element into account. But you could see that compared to other 3 countries, Indonesia, United States, China, Japan, even though Japan is the smallest in terms of its population compared to other 3 countries, by far the Japanese excess deaths so far is far smaller than other three countries, Indonesia, United States, China. This is one of the elements of the evaluation. Perhaps our actual performance of response is not that bad. By this figure of excess deaths, how many people died more than usual time? We have less or smaller number of excess deaths compared to other countries, even taking into account the size of the populations. Next slide, please. And actually, in our previous experience of the pandemic, 2009, H1N1 influenza pandemic, at that time, just compare the three high-income countries, Japan, US, and Europe. This is the comparison, the total number of deaths and the total number of populations and the deaths per million population. Actually, Japan's deaths per million population at that time, 2009, H1N1 influenza pandemic, is far less than our counterpart in US and Europe. So it's not just this COVID-19, but also previous pandemic. We managed to save our lives. Next slide, please. But we also, to evaluate our response, we also need to see other factors. That's what we call stringency index. I mean, for us to actually prevent the spread of the diseases, we actually restrict our socioeconomic activities. Like, I'm sure Indonesia also experienced that, for example, school closure or workplace closure or travel bans. Each and every country actually did it, but in a different degree. And actually, there is a certain comparison of different countries about the level of stringency. To what extent is one country or other country actually conducted school closure, workplace closure, travel bans, and other socio-economic restrictions. And this is the actual measure comparison among four countries, namely Indonesia, Japan, United States, and China. Indonesia, in the score from 0 to 100, I mean, in the first 2-3 years, the actual index is somewhere between 60 to 80. United States also 60 or 50. China is the most strict, the restrictive the country, as everybody know. Its index is up to 80, 76, somewhere between 60 to 80. Compared to that, the Japanese restriction, social restrictions, such as school closure, workplace closure, or travel bans, are relatively mild, 32 up to 50, which means that in Japan, in the first 3 years, Japan actually achieved a minimum number, lesser number of excess deaths by milder the policy in terms of the social restriction. So this is the summary, the review of how the result of Japanese response. How could Japan actually achieve this? Next slide, please. This is what we try to do. There are just the 3 things that we try to do. One is, next slide, please, excuse me. One more slide, please. One is lower the peak of the infections. Second is delay the peak of the infection. The third is enhance the healthcare capacity. With these 3 combination is the key for us to minimize the excess deaths. Once the number of people infected exceeds the healthcare capacity, actually the mortality skyrockets. So for us to prevent it, the approach is just a 3. Lower the peak by various interventions, delay the peak with several interventions, and also enhance the healthcare capacity. So these are the three principles that we try to do. Then how to do that? Next slide, please. There are three approaches that we tried. One is just return to the basic public health measures, meaning that the basics of the infection control is identify the case, isolate the case, and trace the case. These very basic ABC of the public health, the measures actually really works for majority of the infectious diseases, including COVID-19. In Japan, we have more than 500 the health center in every parts of the country that actually played a fundamental role for us to conduct this basic public health measures. Next slide, please. Second is the risk communications. Clear and simple message to our citizens. I mean, the citizens needs to be, we need to reach a simple message to our citizens. And this is our simple message. Just the three messages: avoid closed spaces, avoid crowded spaces, avoid close contact. Just three messages. Simple but very effective message. We've been consistent in delivering these three simple messages repeatedly, and repeatedly. This actually affected. It's quite effective for our population to follow these three simple messages: avoid closed spaces, avoid crowded places, and avoid close contact. This simple message actually worked very well. Next slide, please. The next is the healthcare delivery. We actually need to boost up our healthcare capacity, which is not easy because the number of doctors, number of vets, number of nurses cannot increase rapidly. We have a fixed number already of doctors, nurses, these healthcare, the professionals, and also the facilities. Number is limited and does not increase. So what we did is coordination of hospital beds. By the coordination of each public health administration in local government, the different level of hospitals, primary level hospital, secondary level of hospital, tertiary level of hospital work each other, sharing all the information, how many beds available in each hospital, and what kind of the patient. Is it a severe patient or a mild patient? Could they accept this kind of local coordination of hospitals and the public health administration in each local government really worked? So these are the three ways we tried to mitigate the number of deaths. Next slide, please. I'm a little bit mindful of time, so we move to the summary, the portion. And how do we actually review all these 3 years of experience? In one word, I'd say we should see infectious disease outbreak as a matter of national security. Next slide, please. It's not just a health issue. It's a matter of national security. If we could not handle well, it affects not just human life, but whole the society. It affects whole the nation. So we have to respond wisely. And there are the 5 lessons that I myself learned. First, COVID-19 will surely not the last one. We experienced dozens or hundreds of pandemic or other major outbreaks in human history, COVID-19 being the latest one, still ongoing, and surely not the last one. We have to prepare for the next one. When to come, what pathogen, we still do not know. But what we surely know is it's just a matter of time. Next one will surely come. Second, to cope with the next one, PPR, prevention, preparedness in peacetime, and also response is the key. We learned a lot of lessons from the ongoing COVID-19, and we have to utilize the lesson that we learned from the current one. The next one, the third one, if the next one comes, what to do? It's a simple method. Try to delay the outbreak, try to lower the peak, and also enhance the healthcare capacity. It's easy to say, but very difficult to actually implement. And this is one of the portion that everybody have to work together. Fourth, how to do? As I explained, there are already established way to respond. One important element is return to the very basics of the principle of public health, as I explained. And also risk communication is quite important. What message to convey, deliver to our citizens? Our citizens could not understand a lot of informations, are complicated informations. Make it simple but effective. The third is the coordination among hospitals. We cannot increase the number of doctors, nurses, or beds. The coordination is the key to fully utilize the available resources. Lastly, I myself is a pediatrician, public health specialist, but to respond to a pandemic like this, it's not just a health professional. We need everybody, whole of society approach, not just healthcare professionals, but everybody have a certain role to play. We need the whole society approach. And this is, in my understanding, one of the key elements of Japanese success in responding to it. I'm mindful of the time, and thank you. I stop now. I'm happy to respond to any questions and comments. Thank you very much for your attention. Over to you.
Thank you very much for your fruitful presentation, Inoue Sensei. Now we can enter our next session, which is a Q&A session. We will invite maybe 3 questions from the participants. But maybe before that, we can give a reaction to Inoue Sensei with maybe, yes, appreciation for the very nice presentation. So please feel free to write your question in the chat room, chat box, or maybe you can raise hand. I will invite maybe 3. Ibu Susi, could you please help and see whether, and Julius Sensei, to check whether there are anybody who raised hand. Maybe I will start from my question. Is it okay, Inoue Sensei?
Yes, please.
Okay, so I already write also in the chat. I would like to ask about the community in Japan, whether is there any refusal from the citizen to go to hospitals when they are feeling not well at on the pandemic's era, I mean time. Because in Indonesia, some people, even though they feel not well, they don't want to go to the hospital. They just stay at home and be quiet and don't tell anybody that I'm sick like that. Is there any issues like that in Japan? Thank you, Dr. Indra.
Thank you very much for your question. Not that very much. I mean, in Japan, by the infectious disease control law, up to now, from the onset of the COVID-19, all COVID-19 positive the patients or detected patients needs to be isolated either in hospital or some other facilities like hotel. So it's by law. So under the treatment by law free of charge from the patients. So I mean, basically it's free of charge, and also by law we have to. I mean, and also once a doctor or nurses identify an infected person, there is a requirement for a doctor to report it to authority. And authority have a responsibility to properly isolate either in hospital or hotel facility. So because of these rules and regulations, majority of people are actually properly isolated. And there is not that much resistance for people refusing to go to a health facility for several reasons. One is that basically it's free, even though you are hospitalized or isolated in hotel facilities. I mean, it's free meal, free stay, no need to pay. This is the first one. And second one, there is a risk of disease itself if you do not actually timely go into a treatment. So it's not, I mean, hiding the diseases by yourself is not a clever choice for his or her own benefit. Everybody fully understands that, so that we do not see so many, there are some, but not that much, the cases refusing to a health facility or reporting to a doctor. And it's quite important, interesting to know that there are some cases in Indonesia, and I'm curious and interested to know why some of the people in Indonesia refuses to go to a hospital or seeing a doctor, even though he or she have a symptom. This is a quite interesting comparisons.
Thank you, Inoue Sensei. Maybe Hazukashi, they feel ashamed. But if it becomes worse, of course, if they cannot breathe, then they go to the doctor. But before that, if they have fever, they just have a cough, it's like that they don't want to go to the hospital. Maybe I would like to ask one more question. Is there also refusal from the community to have the vaccine? Because in Indonesia, some people say, I don't need the vaccine. If God wants to call me, I will go home back to God, and it becomes something like spiritual matters. But for me, I would prefer to have the, to have the vaccine properly. Thank you.
Thank you very much. Before answering to your question on vaccine hesitancy, let me go back to the first question. You mentioned Hazukashi or the feel shame, partly because of the stigma, social stigma, putting on the diseases. This is, for example, very evident in the case of HIV. Once you are infected with HIV, there is a social stigma. So infected people try to hide the fact that he's infected with an HIV. So the stigma is a big issue in some other diseases. And to a certain extent, this is the case for COVID-19 because of a social stigma. And I think it's important for the government or society itself to try to remove its stigma. Everybody could actually infect without any his or her own personal failure. Getting an infection, being infected is not your responsibility. It could affect everybody, anybody, and I think it's important for the society and the government to inform, to try to remove its unnecessary stigma as much as possible. So just an additional answer to your first questions. Second question, vaccine hesitancy is really a huge problem in Japan as well, and as well as any parts of the world. In Japan, majority, I would say, of the population accepted vaccination, not just for public health, but his or her own personal health. We actually tried our best to disseminate the scientific, accurate information as much as possible to minimize these vaccine hesitancy, but still it's impossible to eliminate this hesitancy. There are certain small portion of population who resist to get the vaccination. And also there are certain people who actually connects some possible side effects and the vaccination. These are really the difficult issue for us to solve. But for the government side, we tried our best to convey not a bias, but the plain scientific evidence as much as possible. Try our best to eliminate these the vaccine hesitancy. Still, there are some, and this is an issue not only in Japan but globally. And in the next pandemic, we still keep on fighting to eliminate this hesitancy as much as possible by providing scientifically accurate data. Thank you.
Thank you very much for your explanation. Back to Ibu Susi, maybe there is Ibu Riri Rafaela raising hand.
Ibu Riri, dipersilakan.
Terima kasih. Thank you. I'm Riri from Department of Sociology at Universitas Indonesia. Thank you very much for a very informative lecture today, because I learned a lot, not only on the pandemic, but also on how Japan deal with the pandemic. Some comments and questions, if I may. The first is what my colleague has just raised about the reluctance of Indonesian going to healthcare facilities when they know or they think that they are sick during the pandemic. I think, I tend to look at it as a sociologist. Yeah, I think there are several, apart from being ashamed of their own conditions, that is the sickness itself, which might bring some stigma, and it did happen. But also there are other, I think, there are other reasons. One of them is that they just cannot afford to be sick. Because if somebody found that they are sick, then they have to be at home, meaning that they cannot go to work. For people who are working on daily basis and they are paid on daily basis, they are really cannot afford to let other people, especially their bosses, to know that they have a symptom of this COVID-19. And other is, which for me, this is about Indonesia, Sensei. And there is also another thing that I learned during the pandemic is the shift of the concept of sickness among people, among Indonesian people. Because before, for us, being sick is that you develop symptom, and then if you cannot bear the sickness, then you stay at home or you go to health facilities. But with this COVID-19, even before the symptoms appear, you are sick. And in some people, this give a new understanding of the concept of being sick. So actually, there are other things, yeah. I mean, other reasons that I can think of as a sociologist why some Indonesians tend to not going to health facilities. There are also an issue of trust towards the health facilities, because being a country with a huge difference in economic ability among the people, sometimes you get different treatment when you are sick. Even though during this pandemic, all the government, Indonesian government, covers all the cost of the medication. And now my question: since in Indonesia, I tend to see that there are also this shift of understanding of or the concept of being sick, just like I have just mentioned. In your experience, is there any shift in understanding of being healthy, being sick, or being or have to take care of those who are sick? Is there any shift in understanding or shift in the concept being understood by the people of Japan due to this pandemic, or since we have this pandemic? That's the first question. If I may, I would like to pose another question. My other question is, whenever I see television, I can only see Japanese television. I can only watch NHK from Indonesia. And whenever the government of Japan announced something regarding to these measures during the pandemic, the prime minister or the spokesperson always mentions something about based on the advice of a team of the experts. There is always such a statement. So the decision of the government is based on advice of a team consists of experts. This is I noticed that since the beginning of 2020, it is always like that. So meaning that the government of Japan in a very early stage already have an expert, a team, especially think and research on, do research and think and give advice to the government on how to deal with the pandemic. What I would like to know is who are the people in the so-called the expert team? I mean, in terms of their expertise, because you mentioned that pandemic is not only for the medical staff. Yeah, it's about all of us. So I would like to know, if you have the information, who are these people in these expert teams that giving advice to the government in terms of their expertise. So that's my two questions. The first, again, is about, is there any shift of understanding of concept of something regarding health during this pandemic or due to this pandemic? And the second is, who are the experts that is giving advice on the government of Japan in terms of their expertise? Not the name, yeah, but their expertise. Are there medical doctors or lawyers or psychologists or anything? Thank you. Terima kasih, Bu Susi. Saya kembalikan ke Bu Susi.
Thank you very much. Thank you very much for these two questions. Let me answer one by one. The first, the change of the actual understanding of the public on the infectious diseases. Yes, there is a certain improvement in the understanding. What you mentioned is, in the medical terminology, we call it the concept of incubation period. Incubation period means the period between you are infected and you have a certain manifestation of the diseases like fever or cough. There are certain periods, between your infection and also manifestation. This is what we call incubation period. And even during this incubation period, before you getting the high fever, you yourself become infectious to other people. So without knowing any symptoms, you are already infected. You have a capacity to infect to other people. So this is the concept, of course, widely known among medical doctors, nurses, but not the public. But throughout these 3 years of experience, now people in Japan fully understand the concept of incubation period, and they need to be very cautious when they got contact with uninfected people. So these are one of the changes of the Japanese society, and perhaps in the next outbreak, next pandemic, with this enhanced knowledge among general public, I think we could react as a population better than this time. Second question, yes, of course, the final decision, the policy decision will be made by the political leader, like Prime Minister, Health Minister. This is a highly technical issue. So there is the so-called advisory committee to directly advise to the minister and the prime minister, even though final responsibilities are at the shoulder of the prime minister. And your question is, who is actually in the part of this advisory committee? Actually, as you expect, it's a wide variety of expertise in this advisory committee. First and foremost, of course, clinical expert, the medical doctor who is treating the patients, and also the expert in laboratory such as bacteriologist, and also the epidemiologist who is actually trying to chase the diseases. So these are the experts, widely speaking. But not only health experts, there are also the experts in economy, sociology, and also leaders among local government unit, like a governor of the one province prefectures, and also leader in labor union. All these people are actually joining to this committee because it's not just a scientific medical judgments. The judgments needs to be made by economic point of view, or the view from the local government, or view from the labor union. So it's a combination of different actually expertise to form one voice advice to our political leaders. Over to you.
Thank you so much.
Mulya? There is one more question in the chat room. I will read the question.
Yes, please.
Good morning, Inoue Sensei. I would like to thank you for your very eye-opening presentation. As an Indonesian, I do feel that the enforcement of law and rules in Japan seem very holistic and doesn't face considerable amount of resistance from the people in contrast to Indonesia. How does Japan peacefully yet firmly enforce the law regarding the isolation due to COVID-19? The question is from Astrid Wibisono, UI.
Thank you very much. Of course, in Japan, it's the free speech country, so there are a lot of criticism to the policy made by the Japanese government, or a lot of criticism against the way we treat citizens or infected people, and we listen very carefully about all this criticism. But by and large, one of the most important factor for the actual compliance to rules and regulation among citizens is trust. Trust to government, to the government, or trust to the leader. Unless the general population public does not trust our political leader or the government administration itself, of course, they will not follow our instructions and requests. So one of the most important element for us to ask for a compliance to rules and regulation and policy is simply the trust, and the government and the political leader actually tries our best to maintain the trust of the population. This is one of the most important lessons that we learned.
Okay, thank you, Inoue Hajime, Dr. Inoue Hajime Sensei, for your very interesting and inspiring presentation.
One more question, maybe Ibu Susi in the chat room, chat box.
Oh, okay. Yes. Hendra from Mahasaraswati. Would you want to read by yourself?
Yes, thank you. Good afternoon, Inoue Sensei. I'm Hendra from Mahasaraswati University from Denpasar, Bali. I will ask a question. As we all know, the pandemic is still not over, and recently I heard that in Japan there are increased cases of COVID-19. So I would like to know what factors contributing the increase COVID-19 in Japan, because recently in Indonesia the rule of using masks in public places is lifted, so we actually not having used masks in public place anymore. So I would like to ask, so we can be aware of what kind of factor contributing the increases of the virus, of the COVID-19 virus. Thank you very much.
Thank you very much for your questions. Actually, in the past 3 years, the outbreak have a certain wave up and down. And we call the first wave, second wave, third wave of that increase and then decrease, increase and decrease. And currently it's increasing. We call it 8th wave. So in the past 3 years, there are 8 kinds of up and down. Now it's increasing. It is true. And in each time that we have an increasing wave, there are several reasons of that increase. Sometimes it's mainly because of the change of the subtype of the virus itself. Sometimes for seasonal reasons. Sometimes the change of the social restrictions. So it's a combination of the reasons that actually make this up and down of the infections. And now we are entering into the 8th time wave of increasing new cases. Most likely this is because of the actual the release or the release of the social restriction. Actually, it's a balance. Control of the infection is the balance of the social stringency or restriction. To what extent we restrict the social activity or daily activity of the people. And now that we learned how to cope with these diseases, in a daily life and the hospital settings. So, and we feel that we could tolerate a little bit more of increase by releasing the social restriction. So it's a political judgment of how to take a balance between the increase of the patient and also release of the social restrictions. And we are now taking the shifting to more relaxed society, normalize the society at a certain expense of the increase of the number of the new patient. It's not an easy decision, but in any way, we have no choice to take this balance. And now the political leader in Japan, in my understanding, is taking rebalance to gradually normalizing the activities and social life at a certain expense of the increase in the number of the patients.
So there are a lot of factors contributing to the increase. Thank you very much for the answer, Inoue Sensei.
どういたしまして、my pleasure.
Okay, thank you very much. 10 sharp, and we are delayed from the schedule, but I think we are already approaching the end of the session. First of all, I would like to thank you, Inoue Sensei, for the presentation and also for all the answer our questions. We can give a big applause for Inoue Sensei. Thank you very much. So I will return the session to Ibu Susi for the photo session.
Thank you, Lea Sensei. Thank you, Inoue Sensei. Tiba waktunya untuk photo session. Please open your video. Para partisipan harap dibuka videonya. Para partisipan harap dibuka videonya. Masih banyak yang belum nih. Julius, bisa siap-siap untuk take foto?
Baik. Kepada Bapak Ibu sekalian dipersilakan untuk menyalakan videonya. Baik, kalau sudah saya baik, ada di tempat saya sebenarnya hanya ada satu slide yang menyalakan video ya, tapi menjaga-jaga saya ada 4 slide total pesertanya, jadi saya ambil semua saja. Baik, Bapak Ibu semua, saya izin ambil gambarnya. Kita mulai. Oke, 3, 2, 1. Oke, next slide. 3, 2, 1. Okay, and then the next slide, there is nobody here, so yeah, I just take the documentation. Baik, sudah Bu Susi, boleh dilanjutkan.
Terima kasih, Julius. Acara berikutnya, next session is presentation for Inoue Sensei, the certificate of appreciation given by Dr. Diah Madubranti. Dr. Diah Madubranti.
Ya, Ibu Susi.
Certificate of appreciation.
Yeah, okay.
Diah.
Yeah. Thank you very much to Dr. Inoue Hajime. Thank you for your excellent lecture today. It will be a great event for us to learn as our knowledge. We hope you can join us again at another time. And then the certificate. The Ambassadorial Lectures 11th 2022-2023 certificate to appreciation is awarded to Dr. Inoue Hajime for being the speaker on the topic of Japanese response to COVID-19 pandemic. How does it work? The lecture series presented by Center for Japanese Studies, University in Indonesia, in cooperation with Embassy of Japan in Indonesia. On January 25, 2023. Center for Japanese Studies, University Indonesia, Diah Madubranti, and Embassy of Japan in Indonesia, Wakabayashi Takahiro, Chancellor. Thank you very much, Mr. Inoue.
Arigatou gozaimasu. Thank you very much.
Thank you very much, Ibu Dia. I would like to remind all participants to fill the questionnaire and presentation that you already come to this lecture. I think I will close today's session. Thank you very much once again for Inoue Sensei. Thank you very much for Kawakubo-san, and I see there is Julian-san also there. Thank you very much for your hard work connecting us to Inoue Sensei farther in Washington, D.C. And most of all, thank you to all participants who already joined us early in the morning. Even though we have to acknowledge that Inoue Sensei is late at night, 12-hour difference with us. So Inoue Sensei is still in yesterday date, and we are now in today. So this experience to have Omoshiroi lecture, different date, different day. Last but not least, I pray for all of us, our health, and for our economic life, health, and also Inoue Sensei mentioned about learning poverty. Maybe we may still learn even though by a webinar like this. So thank you very much. I then close the session. Arigatou gozaimashita.
Arigatou gozaimashita. Sayonara.
どうもありがとうございました。
ありがとうございました。
お疲れ様でした。またよろしくお願いします。
ありがとうございます。